What's up, y'all? It's Candy Girl with my 2 cents on the American Health Care Act, better known as the Paul Ryan Care or the Trump Care. Whatever the case is, it's some bullshit. That's what it really is. It just passed in the House last week, and so people are kind of just like running around like chickens with their head cut off, and they acting like this is the end of the world. So I'm gonna break down at least what we do know and tell you what my 2 cents is about the situation and what we can do going forward, y'all. But before I get started, let me tell you, number one, thank you so much for my supporters, my subscribers, all of my first time viewers, all of my new subscribers, my old subscribers. I love y'all, especially the people who leave a comment. I love to read your comments, even if it's just like great video. So let's get down to the nitty gritty, y'all. I think the biggest issue that people have about the American Health Care Act, at least for those people who are opposing it, is that, first of all, it's going to get rid of a lot of the subsidies that people were receiving to make their health insurance premiums more affordable. So that's for people like me. To be honest with you, now they messing with my health care. Also, they will be able to raise insurance premiums for people who have had a gap in coverage. So people who are just like rioting against Obamacare and saying, no, I refuse to, even be forced to buy health insurance. I'd rather pay a penalty or whatever. Y'all ain't even gonna get the penalty, whatever the case may be. Now the Republicans are targeting y'all to increase your health insurance premiums. So how do you feel about that? So let's talk about these pre-existing conditions. The bill is not saying that if you have been raped, that's a pre-existing condition and we're going to increase your premiums. The bill probably is not saying that if you've ever been a victim of domestic violence, that that's a pre-existing condition and we're going to increase your insurance premiums. I doubt that. Come on. I think people are exaggerating to get people's attention and to get their sympathy and to make them irate about this whole situation. Paul Ryan said that nobody will be deemed ineligible for health insurance coverage because of pre-existing conditions. Now you got to pay close attention to the way that people word things, and I've explained this in my other video. When people say we're going to return rates to a certain rate, that does not necessarily mean that they're going to reduce the rate. And in this situation, saying that people won't be denied coverage may be true, but they can make it inaccessible to them by raising the insurance premium to an unaffordable amount. You're forcibly making them forego that particular health insurance plan because they can't afford it. And I have a real problem with that. Now, they're not, I don't believe that the bill says if you've been raped as a pre-existing condition. I don't think that it says that. What I think that it probably says is that pre-existing conditions may include anxiety, depression, traumatic wounds that have a chronic health condition tied to it, previously diagnosed STIs, stuff like that. Rape victims usually have some PTSD, anxiety, depression. They might have contracted an STD. They might have had to have an abortion because they were impregnated as a result of that crime. People who were domestic violence survivors, they may have had severe physical trauma that requires them to seek ongoing medical care. So it's the condition itself that arises as a result of those crimes that are pre-existing conditions. So watch what people are saying, politicians and journalists alike. Pay attention to what they're really saying, because I highly doubt that they put rape and domestic violence as a pre-existing condition. But people who have been raped or been victims of domestic violence will be disproportionately affected by the community rating system. That's what they're really saying. Let's talk about another thing that people are really complaining about. The lawmakers who voted in favor of the American Health Care Act do not know exactly what's in that bill. They have not read the bill for themselves. So how is it that you are able to vote on something that you know nothing about? That screams corruption to me and laziness. Now, I have got two different opinions about this, and y'all tell me what y'all think in the comments, definitely on this issue. That bill is probably 1,500 pages long. It takes me weeks to finish reading a book that's 200 pages long. What makes you think that in 3 days I'm about to be reading a 1,500 page bill that is probably filled with all kinds of confusing language, long sentences, big words, big concepts, and things like that? It's got to go through the CBO to have a financial analysis conducted on it. You know, they don't have time for all that. So what they do is they get 10 analysts together who are going to read 150 pages each and give me a 15 bullet point, 1 page summary on what you read as part of your portion of the bill. Tell me what that is. And then they all compile it together. He reads that and boom, you know, he's able to at least know what is being said in the bill in the big picture sense. And they're less likely to miss a material provision that is going to affect their constituents had they not read the bill. Okay? And y'all just realize that this is a common practice across all industries for top high level officials and professionals. Judges have clerks, doctors have nurses, program managers have analysts, you know, the president has a cabinet. You know, legislators have legislative analysts. Like, everybody has an assistant, someone that's going to actually do their job for them and just tell them what to say, or at least do a lot of the legwork for that person so that they can just sit there and read a summary and make a decision. I'm not saying that they're inadequate because of using those services and delegating responsibilities, but what I am saying is that when you're under a tight deadline and you've got a lot of other competing interests, sometimes you've got to delegate things to other people so that things get done and that you can at least have some point of reference on this bill that you're about to vote on in 2 days. So, you know, you guys got to lay off a little bit. But at the end of the day, you need to know what's in this bill. Even if you have to read a 150-page summary on the 1,500 pages that you could have read instead, do something. But you need to know what's in there before you vote. Otherwise, it screams corruption to me, or at least somebody who's too lazy to really do his job and they don't need to be in office anyway. So, what now? You know, what are we going to do now? Go on Google and find out who is your, you know, senator. I know of other organizations, one of them being the Wolf Pack. Look them up. They're a political, you know, activist kind of group that goes straight up to the politician. They will go to the politician's office in hopes that that person will be swayed one way or another. So I would encourage you to do something like that. I know that I send my representative and my senator all the time. I send them communication saying, please fund this, please vote against that, please vote in favor of this. I make sure that they know where I stand and what I'm hoping they will do about it. All right, y'all. Until next time, love and blessings.